everybody, this is Dr. Michael Scherer. It's a real pleasure to be here at the official release party of the new Medit i700 intraoral scanner. Medit has come up with some really incredible new innovations with their new i700 scanner. Things like an interchangeable tip, a new and improved lightweight and ergonomic design, and a UVC bulb built into the scanner. Wow, some incredible things that we just can't wait to share with you. Look forward to seeing you here today. Thinking of innovative ways of how we can treat patients utilizing an intraoral scanner like the i700 is really incredible. One way that I find that truly remarkable is doing anterior aesthetics. When we think about the patient when they first come to us, they're very self-conscious about the idea of going without a front tooth. For some patients, that could be a barrier for treatment. By utilizing intraoral scanning, I can go ahead and create a digital database of the patient before we extract their tooth, and use that as part of treatment planning purposes, not only from a surgical point of view, but also from actually being able to design their final restoration. By utilizing some of the features within the i700 scanner, scan compares, looking at multiple scans, and then being able to create a digital database is truly remarkable. In our clinical case example of utilizing the Medit i700 scanner for anterior aesthetics, we have a patient that came to me because he had one tooth that got knocked out. Tooth number 7, a lateral incisor, got knocked out during a bar fight. Sure, there's a story behind that, but the patient kinda didn't tell me the whole story, nor did I ask. But we kinda winked at each other and said, "You know how I lost it, doc." When a patient comes to us for anterior aesthetic needs, we wanna go ahead and utilize our intraoral scanner in a creative way. When we utilize our intraoral scanner, in our clinical case example, we had a patient that lost a single front tooth, which can be a traumatic experience for a lot of patients. But before that patient had that tooth removed, we went ahead and we scanned that patient using our i700 scanner to create a digital database of that tooth for planning purposes for surgery, as well as for our final crown restoration design. We first begin by scanning the patient's mandibular arch. Beginning on the premolar of one side, we scan on the occlusal surfaces, slightly rolling buccal and lingual as we traverse across the posterior dentition. Returning back to the anterior dentition, we can then roll facial, lingual, until we get to the opposite side. Then start going across the occlusal dentition, slightly rolling buccal and lingual, just to capture all of our detail and anatomy. Going back throughout the scan, we can then start rolling all the way around on the facial and lingual to capture any of the details that we missed during our first pass. Verifying that our scan has been complete, I can use the innovative joystick control functions within the i700 scanner to inspect the scan by rotating, and we can inspect the scan by moving the scan around. Properly verifying that our scan is complete by using the touchless controls is an incredible new feature in the i700 scanner. I can then move on to the next stage, which is capturing the upper arch and the soft tissue of the patient's implant. We can then go ahead and jump to the next screen using the Medit blue button, holding the blue button down and advancing to the upper arch. I then remove the healing abutment from the patient's implant and scan the entire maxillary arch, starting on the posterior dentition around the premolar and rolling buccal palatally until we get to the anterior, rolling facial palatally, get to the opposite side of the arch, buccal palatal until we captured all of the relevant details of the anatomy. We can then go back on the upper maxillary arch scan and fill in any of the details that we may or may not be missing in the different areas of the scan. Once we've completed our initial scan, we can then go back and start filling in some of the details of the areas of the scan that we noticed during our inspection mode. We can then go back to the area of the soft tissue around the dental implant, capturing all of the details and relevant anatomy around the soft tissue conformation in the dental implant site. By utilizing the power of the Medit i700 scanner, we can dynamically change the focal distance of the intraoral scanner, a very cool feature that not many other intraoral scanners can do. We can then change the focal depth so that way the focal depth is increased to capture all the depth and details of the soft tissue around the dental implant. By knowing that our tissue has been sculpted around that healing abutment, we can then design a restoration to fit effortlessly within those contours, or potentially slightly change the contours of the area around the dental implant in our design software. Once we've gone ahead and we've done our scan of our patient's scan area around their dental implant, we can then use the joystick controls within the i700 scanner to inspect all the details around the soft tissue, around the dental implant, and the dentition. Verifying that all the details are captured, we can then advance on to the next stage, which is capturing the bite. Inspecting the bite scan, verifying that the patient is properly closed into their proper occlusal relationship, MICP, or centric. We can scan the occlusion on the opposite side with the second occlusion scan to verify that the patient is in proper occlusion on the scans. Once we've captured the proper occlusion scans and the scan of the patient's upper and lower, we can then go ahead and proceed by placing the scan body onto the dental implant. After our initial scans are complete, we can go ahead and place the scan body onto the dental implant. Ensuring that the scan body is seated down all the way, we're going to orient the position of the scan body geometry to best fit our future restorative needs. And in this case, we're going to be using a titanium abutment and a ceramic crown restoration. I've oriented my scan body so that way it's oriented correctly for that need. After orienting our dental implant scan body, we can go ahead and make a radiograph or x-ray to confirm that the scan body has been seated down all the way. After the x-ray confirms that the scan body is seated all the way, we're ready to proceed on to scanning the scan body with our i700 scanner. When we're ready to go ahead and start the scan body scan, our scan body is in place and our AI scan body matching mode assignment has been completed. We then start scanning the occlusion of the teeth adjacent to the scan body to ensure proper alignment of the scan prior to proceeding to scan the scan body itself. Once we've ensured that we have the proper alignment, we can then start a facial palatal roll to start really bringing all the geometry of the scan body into the i700 software. Once our intelligent AI scan body matching mode recognizes the scan body, it instantly gives me verification that the scan body has been scanned correctly and it's been aligned to our scan that we have completed inside the mouth. Once we've verified that the alignment of the AI scan body is complete, we can then complete our scan and inspect by using our joystick control to roll around the scan to verify we've captured all the relevant features and our AI scan body is complete and aligned properly. On our laboratory computer, we can begin by just opening up the scan file from our Medit i700 scanner that's already programmed from my dental lab planning software. I simply follow the prompts within our dental laboratory planning software and start morphing and molding the design of the patient's restoration. Utilizing the patient's original tooth as a guideline, I can go ahead and effortlessly merge multiple files together as references. And what we can do with the power of the link between the Medit i700 software and intelligent dental laboratory design software is effortless. To be able to go ahead and 3D print a patient's permanent tooth within just a few hours. Once the permanent crown restoration has been cemented, we can then go ahead and proceed to go over to our clinical area where our patient has returned. After 2 hours, the patient is returned and is now ready for their 3D printed crown. The patient comes back in, we can remove the healing abutment, show the patient how cool it is that you can see you've got a 3D printed permanent crown. Wow, it's truly amazing. And we can go ahead and show that to the patient. As we start seating, we notice that the 3D printed permanent crown restoration drops right in. Because of the power between the i700 scanner's accuracy, precision, and speed, matching it with the AI scan body matching mode and color map reliability scanner, intelligent bridging and connecting to our laboratory design software, and then over to our additive or subtractive manufacturing technology, we can do incredible things. When that crown drops right in, the patient looks at me and goes, "What just happened?" I said, "I just gave you your permanent 3D printed crown." The patient's like, "What? I didn't feel anything. Really? Show me. I don't believe you." And he looks in the mirror and he goes, "This is the most incredible thing that I've ever seen." We can then go ahead and take the patient's 3D printed crown, take an x-ray, verify that the 3D printed crown is accurately tightening it down, hand tighten to confirm complete adaptation. We can then show the patient how the tooth looks in their mouth. The patient is often very excited when they see the restoration in their mouth because they're like, "Just a short couple hours ago, I didn't have a tooth there. Now I have a permanent tooth there." It's truly an incredible thing of what we can do with this incredible i700 scanning technology blended with intelligent laboratory design software and 3D printing. Sealing up the screw access channel on the back, We then tell the patient, you're done. And the patient looks at me and says, wow, that's incredible.